OSHA and safety data sheets. Employee exposure to mercury is regulated in the United States by the 1970 Occupational Safety and Health Act and Workers' Rights Handbooks from the United States Department of Labor's Occupational Safety and Health Administration, OSHA, which established that all employees have the right to know about the chemicals in their work environment. OSHA's Hazard Communication Standard, HCS, states, quote, all employers with hazardous chemicals in their workplaces must have labels and safety data sheets for their exposed workers and train them to handle the chemicals appropriately. The training for employees must also include information on the hazards of the chemicals in their work area and the measures to be used to protect themselves, end quote. The purpose of the safety data sheets, SDS, formerly known as Material Safety Data Sheets, or MSDS, required by OSHA, is to protect workers by supplying them with the most crucial facts about the hazardous materials at their job site, such as the physical properties of the material, proper storage and handling techniques, known health risks, and essential emergency procedures. Thus, manufacturers of amalgam fillings must create these information sheets, and excerpts from just a few of the SDSs for dental amalgam includes compelling evidence about the known dangers of using mercury in fillings. SDI Permite Logic, when describing their different capsules of amalgam in Australia, Brazil, Ireland, and the U.S. in 2015, state the following. Hazard Identification California Prop 65 Warning, quote, this product contains mercury, a chemical known to the state of California to cause birth defects or other reproductive harm, end quote. First aid measures, quote, may cause respiratory disorders including inflammation and fluid retention. Inhalation of mercury vapors at high concentration can cause dyspnea, coughing, fever, severe nausea, vomiting, excess salivation, kidney damage with renal shutdown, end quote. Toxicological information and chronic health effects. Quote, inhalation of mercury vapors, dust or organic vapors, or skin absorption of mercury over long periods can cause mercurialism. Symptoms include tremors, inflammation of mouth and gums, excessive salivation, stomatitis, blue lines on gums, pain and numbness in extremities, weight loss, mental depression, and nervousness. Exposure may aggravate kidney disorders, chronic respiratory disease and nervous system disorders, may cause damage to blood, kidneys, liver, brain, peripheral nervous system, and central nervous system, end quote. Kerr Corporation, when describing their Titan capsules, USA 2014. First aid measures inhalation, quote, adverse symptoms may include the following: reduced fetal weight, increased in fetal deaths, skeletal malformations, salivation, metallic taste, eye irritation, respiratory tract irritation, coughing, pulmonary edema, wheezing and breathing difficulties, headache, fever, nausea or vomiting, diarrhea, abdominal cramps and pain, muscle weakness, pain, mental confusion or disorientation, end quote. First aid measures on skin contact, quote, adverse symptoms may include the following: reduced fetal weight, increase in fetal deaths, skeletal malformations, end quote. First aid measures for ingestion, quote, adverse symptoms may include the following: reduced fetal weight, increase in fetal deaths, skeletal malformations, end quote. Henry Schein, when describing their capsules, stratosphere, ionosphere, and troposphere, USA 2016. Risk phrases, quote, may cause harm to the unborn child. Also very toxic by inhalation. Also toxic, danger of serious damage to health by prolonged exposure through inhalation, end quote. Additional toxicological information, quote, avoid exposure of mercury to pregnant person, end quote.